I am originally from Philadelphia, Pennsylvania. I currently live in southern Jersey, and I work at the Children's Hospital of Philadelphia. I'm an advanced practice provider in the emergency department with PICU experience, and I also teach at Drexel University in their nurse practitioner program. We're a level 1 trauma center. Our stats came back recently that we saw almost 100,000 children last year in the emergency department alone. It runs the gamut. So I take care of kids who have absolutely nothing wrong with them, whose parents are just worried, and you just need to reassure and communicate, to children who are brought in to die, whether they've been on hospice or palliative care, life-threatening illnesses, sudden acute events, trauma. Believe it or not, it's interesting. Despite having almost 100,000 visits last year, we had less than 20 patients die within the emergency department itself. So prior to that, I have also done work in the pediatric intensive care unit, and that was as a bedside nurse. So my role evolved from a direct caregiver in terms of following out orders that were written by an individual, as well as providing comfort and care to a patient and family, to then becoming the person who is deciding the care that needed to be provided for the families. I remember there was a 4-year-old who got brought in. He had developed what's called torticollis, where his neck was tilting off to the side, which is very unusual for a 4-year-old unless they've had like trauma of some kind or they've strained it. But to just have torticollis with no pain is usually an indication that there's something going on in their head. And I'm going through information. Well, we had seen our primary care several weeks ago. They want to start PT. It's taking us this long to get PT. He hasn't been himself today. Then he started vomiting, but he's been vomiting almost every day. It's usually after he wakes up. These are all huge red flags that are blowing up in my brain. We sent this kid up for a CT scan. He's got a huge brain tumor. And now I have to walk back in. And the mother said to me, of all the things that was going to come out of your mouth, I was not prepared for that. In the PICU, I often became the person who was given the families who needed to be told that it was okay to stop and to let go. Children are different. Parents never want to see their children die. And sometimes they need permission. And what I was often seeing in these families is that people were so vested in making sure that they had explored every option and every hope, and never wanted the families to feel like they hadn't explored every option. That they didn't often present the option not to treat or withdraw as equally as do everything in the world. And I had a unique ability to say to families, what point for you is enough? And if you can't answer that today, what do you think you have to do in your life to feel like you've gotten to that point? Often after those conversations, families would make the decision to withdraw or to stop escalating care, because they felt like somebody was having a realistic discussion with them. Because you have to acknowledge for the family that they're in pain and they're suffering as well. Because yes, they're all within this process together. We always debrief afterwards what went well, and it's concentrating again what was positive that happened that we can reproduce to try and provide a better outcome for the next person. What do we need to work on? And then also acknowledging the humanity of ourselves. We need to cry. You need to be angry. You need to feel badly. Sometimes you need to walk away and take a break. So a lot of it is also saying those things that still make us human and able to care for people need to be reinforced and re-encouraged.